You're listening to Navigating Eldercare, where you'll find guidance and answers for every step of the eldercare journey. Each week, eldercare advocate Laura Daniels brings you expert insights and practical solutions to help families and professionals make confident care decisions.
Hello, my name is Laura Daniels, founder of Care Advocates and your host for Navigating Eldercare. For years, I have been helping families and medical providers, doctors, case managers, social workers, nurses find the right solutions for seniors in transition, whether that is after a hospital stay, a rehabilitation stay, or when the care needs at home have changed. We assist in finding the right care options for families. I started this work because I saw how overwhelming and confusing the elder process can be, and I wanted to be a guide and a resource for families and professionals. Each week on Navigating Elder Care, we tackle real questions and challenges that families and providers face during a care transition. In my business and in my work at Care Advocates, we walk alongside families every step of the way. We meet with our families, clients, and providers to create a customized care plan when someone is not able to take care of themselves anymore, whether that's someone needing assistance with bathing, dressing, mobility. We provide them with options such as residential care homes, assisted living communities, memory care communities, or caregivers at home. We advocate, guide, and educate throughout the entire process. But most importantly, we provide ongoing solutions and support. The care journey should never feel overwhelming. It should feel guided, supported, and understood. Welcome back to Navigating Elder Care. I am your host, Laura Daniels, and in today's episode, we are going to be talking about in-home care, that is, caregivers at home. My guest for today's episode is Arthur Pike, founder of River City Home Care, a leader in home care with over 20 years of experience helping families remain safe, supported at home with personalized caregiver services. Arthur, welcome to Navigating Elder Care.
I'm so excited to be here, Laura.
It is an honor to have you here. You and I share the same passion for helping families, our community, and the elderly. Can you tell us a little bit about, let's start first by defining, Arthur, what is in-home care?
Yeah, I mean, it's a great question. In-home care always is having somebody at home support them, like a caregiver, with their activities of daily living, which would be, dressing, incontinent care, bathing, and then also provide them with medication reminders, providing them a meal, taking them to doctor's appointments, taking them to maybe fun events like senior centers, visiting families, those kind of things. So it's really a caregiver at their home, wherever they call their home.
Arthur, how is it different from in-home care? And in Mike's, working with families, they're confused. What is the difference between in-home care versus home health?
Yeah, we get that a lot. So we will have, home health is when someone is getting ready to discharge, whether that be at a hospital, a rehab center. They're going to go home typically with a physical therapist and nursing over, seeing the care. So it could be physical therapy, occupational therapy, speech therapy, and then nursing care. And so and those are all paid by their insurance, their Medicare or their private insurance. And so what happens is they're going to come in, let's say a physical therapist will come in and spend about an hour 2 to 3 times a week. So we then come in as in-home care. We come in and we provide the support after that. So it's 1 hour for them. It's 4 to 24 hours for us. So we then become the advocate for the family, or we become the eyes and ears for the family, and we then become the support. So the family can continue to be family, and we are the caregivers. We will provide all those things we talk about with helping them with incontinent care, helping them, things that families don't want to do anymore, helping them get them a meal. So, you'll have people that don't want to eat anymore. So, what we've learned is let's cook a fresh meal for them where they smell it, hear it, see it, and now all of a sudden they're hungry. So we're doing those little things for in-home care.
With home health, as it's short-term, very quick, for 30 minutes, 45 minutes at the most. And that goes away after a few weeks. But with in-home care, that is caregivers that are assisting someone for as long as they need to be assisted, like you said, 4 hours or 24 hours, as long as they want. Arthur, can you tell me what inspired you to begin your business, your in-home care business, 20 years ago? Congratulations. You were locally owned. You are the owner. Can you tell me what was your inspiration for starting this?
Well, we're really proud of our 20 years. 20 years is coming up in May of 2026. And so, we were one of the first in town, and really we're the last one that still is locally owned and operated from San Antonio. So it's a labor of love. I have a business partner that I met in college, and he needed care for a grandfather. At the time, he was a pharmaceutical rep, and he had some times where he didn't have to be in an office, so he was able to go and help his grandfather an occasion. But when he couldn't, he needed to find care and could not find. There was nowhere to go to try and find just someone to provide care. And so he called me, and we started River City Home Care. And so it's been a labor of love ever since. We look at everyone that we care for like our own family. We treat them that way, and we think about them that way.
I know, it's impressive. 20 years, you're not a franchise. You are boots on the ground. You're highly respected in the community. And it's great to to speak to the owner of an agency is always important.
Well, and I want to say something, Laura, too. I will say I might be an owner. I am every day still walking. I did the caregiving part. I did the scheduling part. I've done the state survey part. I still do it, and I love it. Every day, if you called me or a referral calls me, I take that call. I call that family. I go see that family. That's the commitment that we continue to make as an owner, is that I'm in it, and I love it. And that's why we have such a great tenure in our office.
Mm-hmm. Arthur, let's talk about who needs in-home care. Can you give us who's your typical client, ideal candidate for someone receiving caregiver support at home?
So great question. I think, in-home care, you really, we're recording this during the holidays. And so when you go home and see your loved one, your grandparents, your uncles, your aunts, your parents, and you just start to see them slow down. So little things start to happen. You start to see someone that really had a green thumb, and all of a sudden their plants seem to be dying. You see stacks of mail piling up, and bills aren't being paid. So you just start to notice those things. That's a great time to call us.
They're walking different.
Yes.
The refrigerator's either empty or filled with expired food, all the little things.
That's right. You as a family member how your loved one has changed, and so it's just a great time to start calling us and say, we need help. That's kind of the one of the reasons, right? The other one is you're going to have a loved one go in and have a hip replacement or a knee replacement, or they've been in a hospital for any of the things that you can imagine. So they're coming out of the hospital, and they're going to need that extra support back home. Mm-hmm. You don't want them home alone.
Absolutely. Arthur, what about respite care? Do you assist with if somebody's going on vacation for a week or two, or maybe that spouse who's a caregiver is having surgery herself? She needs someone to sit with her husband for just 3-5 days. Do you provide respite care?
Oh, yeah. I think that's really important. We do that all the time. So families may have grandmother living with them and say, we haven't taken a vacation in 3 years because we didn't know what to do. Well, call us. We'll go in and we'll care for grandma, who doesn't probably want to go on vacation with you all, and give you all a break so you can leave for a week or two or however much you need. And then always, like you said, too, you've got the spouse who now has to have surgery or something's happened, has a hospitalization, and you need support. Call us and we could do that.
Let's talk about common misconceptions, right, when choosing in-home care. And I'll give you mine that I get from families is that they have to sign a contract. They have to be with you for a certain amount of time. Let's start with that first. Is there a minimum amount of days? And you touched on it a little bit. If someone's needing 4-day break or a 1-week vacation, what is the minimum amount of hours, days that they have to commit with you, with River City?
Well, thanks for asking that, because there are some misconceptions, and you're correct that we're not a contract. You're not ever going to sign a contract. The only time that we charge you is when we actually care for you or your loved one. One of the really important things is is understanding that when we're there, we're going to be working, we're going to be doing things. And so I think, misconceptions come where you're not understanding what's going to happen. And then your loved one saying, you're taking my independence away. You're going to, well, we're not there to do that. Well, that's a big misconception. We're there to keep them independent and safe at home. And then be eyes and ears for you, the family.
Okay. Arthur, why should families choose a professional caregiving agency like you, like River City Home Care, versus hiring the neighbor, the friend from church, or the third cousin to come in and help?
Yeah, I think there's so many reasons, right? First and foremost would be the having oversight of the person that's caring for your loved one. That's so important because you can hire the neighbor, the distant relative, the friend, but you really don't know what's happening because no one has oversight for them. Meaning, we have multiple supervisors that go in and do supervisory visits. We'll be calling that your family member and asking how things are going. We'll be calling you and saying, what are you hearing from your parent? So having oversight is really important. Yes, a home care agency like mine is probably more expensive than having to hire someone privately. Absolutely. But we also do a thorough background check of everyone, and that's really important because when you hire even a distant relative, you do not know what their history looks like. And we all know typically, people tend to repeat their history.
Absolutely.
And so it's really important that you just have the oversight, and then you have someone like us that has done a thorough background check on these people that are going to be caring for your loved one.
I think my experience with working with families who hire, the neighbor, the third cousin, the aunt, is that they then become the scheduler when the shifts are missed, and so it's overwhelming, right? And you, with hiring someone like you, a professional like you provide the ongoing education, the training.
Yeah, I'm glad you brought that up, Laura, because you're right. Our model is let us be the caregiver and the scheduler and all that goes with that, and let you be the family. You should come in with your grandmother and be the grandson and be able to talk to your grandmother and not have to get up and go figure out or call us and, no one's there, no one came, who's coming, what are they doing? You shouldn't have to do that. You should just have a good time and sit down with your grandma. And
also, Arthur, in working with you, I know that not only is that client, that family, your priority important, but just as important is the people that work with you, your caregivers. So you also provide that support for the caregivers, that ongoing advocacy, education, and supporting them while they're working, just to be there to listen.
Yeah, the continual education, the support. We do a holiday party every year, and we bring them in and just have a great time with them. And so they know, the big difference being locally owned and operated is that we have offices, here. And so they can come into our office anytime and can talk to us and call us. There isn't, and so, the support goes both ways.
Let's talk about, Arthur, when a family signs up with you, with River City Home Care, what does that onboarding process look like? And family involvement. Can you talk a little bit about that?
Well, really what we have figured out is it is such an individualized situation. It's never going to be the same, meaning that if you call me, if the family calls me, I'm going to go with what the family is telling me they need. So it could be someone that's not in town and they just want to talk through, how do we start this? What do we do? So it could be conversations and ongoing conversations about how do we get started. Once we get started, or sometimes we just may need to go in and do an assessment. So we'll have one of our care managers go in and do an assessment of the home and the person that we're going to care for, and figure out what exactly we have to do. And it's very individualized, but we keep it simple. It starts with just a conversation, and the family gets to let us know how we need to navigate this. In the case the family does not understand what they need to do, then we really start with our questions. We go through and we'll guide them what they need.
And even if they don't choose you for in-home care, you will guide them, because you may find that they have other needs, right? So you will guide them and give them resources.
Correct. You imagine 20 years being here locally owned and operated. We know just about every group in town that does the support, that can support all the things that
our
your loved ones.
Trusted partners, right?
Yeah, we have these trusted partners, and so we know how they work. We know their ethics. We know their nurses. We know their therapists. We know their managers. We know their owners. We've really kind of gone through and done that so that we understand how to support someone. So they don't have to choose me, but I am always willing to give them the information that they might need.
How can our families, listeners, how can they get a hold of you, Arthur?
So very easy. Call us. Call our phone number, get onto our website.
Arthur, let's talk about, as a registered nurse and having done utilization case management as a case manager, that hospital to home discharge is so important. As a hospital, as a skilled nursing facility, you don't want readmissions, and we know that the majority of rehospitalizations happen within the first 72 hours when somebody gets home from a hospital or a skilled nursing facility. How do you help with that? How do you help to reduce the readmission back to the hospital?
Yeah, so this is a good place to just step back and think about this, right? Imagine you've gone into the hospital, you went into rehab, and you were there. Let's say you did the 21 days of physical therapy, but you had hands-on, someone around the clock with you doing hands-on, and all of a sudden you go home. And so the reason there's such a potential for readmission in those 72 hours is now you've got someone at home who was so used to having that extra hand. Mm-hmm. So we need to be that extra hand for them.
And now they go home alone.
They go home alone.
Or with another spouse who's also 87 like they are.
Right.
Yeah.
And so they're just going to need that extra support to make sure that they stay safe, to make sure they're not trying to, what happens a lot of times is they think they can go right back to the way the life was right before this injury or whatever they got in the hospital for. And sometimes they can't. They need a little help. And so having someone to give them that helping hand is what we do.
And you assist with the medication, the medication reminders, the fall prevention, the emotional and mental health support. And Arthur, you've seen, you and I have been there. When somebody gets home from a hospital, they get home with bags and bags of, discharge paperwork and more information. So just having you guys there for those 3 days is so important.
That's right. And also, the other point too is that, I'll touch base on that, but also helping coordinate all those the care things that are going to happen. So if they're going home with home health, right, like a nurse in physical therapy, occupational therapy, we can become advocates there for them too. So meaning that we can figure out, okay, family needs us there 3 days a week. Let's ask home health to be there those other 2 days that we're not there, even though they're only there for an hour or less. But at least the family has someone there. So it's we can coordinate care. We can help with making sure they're taking their medications. All we do is reminders, but we can make sure that that's happening. We'll make sure that the family knows what we're seeing so they can help us figure out how do we continue making sure that they stay safe at home.
Can you talk a little bit about your portal and your communication? Yeah,
it's a game changer now. We have this family portal. We call it a family room, really. It's virtual, but what that means is the family can see the caregiver, the person that's there caring for their person. They can see the time that they showed up, what hours they're going to be there. They can see the notes that we're making. So, mom decided she wanted to eat eggs and bacon, or whatever. We'll make notes of every detail that we can, so that the family can see how that day went with their loved one. And again, what's important, you can be anywhere in the world and see that. So you don't, you're not worried about how did it go today? I wonder how my loved one did. I wonder if they ate. I wonder if they took their medication. Well, you'll be able to log into the portal in your family room and see that.
And multiple people can be on there, right? If it's 5 siblings.
Yeah, we've got clients right now. We have one particular one, 3 daughters. They all log in and all chime in on what they see, and it's great.
Arthur, there are so many in-home care agencies, right? And you have a great list of questions that our listeners can call, and we can send it to them, or they can call you, and you can share that list with them. What are the questions, right? What is the most important questions that families should ask when considering in-home care, caregivers in their home?
Yeah, we'll keep it simple. I think it's the first thing you want to ask is, are they licensed? And are they licensed through Texas Department of Health and Human Services? That's important because that there's an oversight over the group that you're hiring. Mm-hmm. The other thing you want to make sure, that gives you a safety is that they're bonded and insured. So it's got to be both, bonding and insurance. And then some of the questions really are, are you going to do a background check? And then if it's yes, because they should and they have to, then are you going to hire anyone that has a background? Those are really important because there are groups, and we are allowed through the Texas Department of Health and Human Services to hire certain people that have records that are past 5 years. We've made a decision 20 years ago, and we've never changed that we will not hire anyone with any background. I think that's really important.
So repeat the question again. It's so important. Will you hire anyone
that has a background? A
background. Okay, that could mean like theft 7 years ago.
Yes, that can mean theft 7 years ago. There's a list of things you can imagine. So I think that's an important question.
Tell us about how you bill. Do you accept long-term care insurance?
Yeah. So there's a couple things. It's very simple. And we'll talk a little bit about the differences between us and home health, right? So home health is covered by their Medicare, Medicaid, or private insurance.
Right.
We're just private pay. It's an out-of-pocket expense to have us. Unfortunately, Medicare has not deemed us as a necessary event, and so that means you got to pay out of pocket. But we will, if you've ever bought a long-term care policy through your insurance or your investment advisor, we can bill that directly, and we can help you navigate that because we've worked with long-term care policies for the last 18 years and really know every single company and our what we consider preferred providers with every company that exists. So we can help, but you're going to pay out of pocket or we're going to bill your long-term care insurance.
Arthur, in closing, I want you to share that one moment, that one family, that one story that reminds you of why you do what you do. And you do it every day. I know that for 20 years.
Yeah, I love that question, Laura. I think, we have so many stories, but there are, I have a particular lady that could not walk anymore because of some injuries that she had. This was a lady that was a bariatric lady. And really what that meant was she couldn't get up, but she wanted to go home, and she'd been sitting in a nursing home. And it was probably the right place for her at the time. But she wanted to go home, and all the family said is that she wants to go home. We don't know how we're going to do this. Well, because we've done this long enough, I went and told her, what's your goal? And she says, I want to walk again, and I want to go home. And so we got her to understand that she needed to stay at the nursing home for another month and work really hard at least getting her feet up and being able to help us, because it was going to be really, really hard to get her home with one caregiver. So we got her home, and we stayed with her for 3 years, and it was amazing. She was able to walk, and she worked really hard for the 1 month at the nursing rehab center to start to pivot and get up. So it was just an amazing. The family was they loved it, and we've been mentioning in her obituary when she's passed, and we've been mentioning many times. The family still stays in contact with us, and we know we're doing the right thing, because this is all we do. By the way, we just do home care.
That's it.
Yeah,
that's impressive, and it's what you do. It's such a gift, because in the work that I do, helping families find assisted living communities, memory care communities, residential care homes, no one ever wants to leave their home. Everybody wants to stay home, and you are able to provide them with that service with bringing caregivers into the home.
Yes, we try.
Arthur, I thank you for being here today, for sharing your insight and your story. Where can families call? Where can they call to learn more about River City Home Care? And if you can also give us your website.
Well, great. Thank you. Call us at 210-342-2273. That's 210-342-CARE. Someone will answer always. And then our website is rivercityhomecare.com.
Okay. Thank you, Arthur. And I thank you for joining me on Navigating Elder Care, where we bring guidance and answers for every step of the elder care journey. Whether you are a family member, a hospital case manager, a healthcare provider, and you know someone that is facing a change in health or planning for future care needs, Care Advocates is here to help you every step of the way. We can help you find the right care at the right time. Whether it is assisted living communities, memory care communities, or bringing community resources like Arthur and in-home care into your home. We walk alongside you every step of the way. Our commitment is simple: care, compassion, and a lifetime of support. For a free consultation, call me, Laura Daniels, at 210-669-2222. You can also listen to past episodes on YouTube or listen on your favorite podcast application. You can also listen to us here every Sunday at 8:30 on 9:30 a.m. The Answer. I am Laura Daniels, and this has been Navigating Eldercare, helping you find the right care at the right time for the people who matter the most. Thank you for listening.
This has been Navigating Eldercare with Laura Daniels, providing guidance and answers for every step of the eldercare journey. For a free consultation, call 210-669-2222 or email laura@advocatern.com. Catch every episode on 9:30 a.m. The Answer, YouTube, your favorite podcast app, or at advocatern.com.